This segment is sponsored by HomeTown Pharmacy. They call themselves your trusted pharmacy partner, and they really are invested in each patient's unique needs with their HomeTown Healthy program. President Jonathan Grice is here to explain how this functional medicine approach works. It's good to have you here.
Yeah, good to be here with you.
Yeah, tell me about HomeTown Healthy.
Well, our HomeTown Healthy program is really focused on functional medicine. And as we've talked, it's the vitamins and nutrients that our body needs to have the normal processes working as they should. So our pharmacists, our vitamins out front of our stores are geared towards making sure that our patients are getting everything that they need in a day.
So someone comes in and they're maybe being treated for diabetes. Sure. So what you do is going beyond the insulin that they might be being treated with. You treat the whole person and all of the things that might enhance that traditional treatment for a diabetic.
You got it. We want to make sure that their prescriptions that their doctor has written for them are filled and accurate and all of that, that they understand them, know how to use them. But we also want to back up a half a step and make sure that all their vitamins and the things their bodies just need for normal processing are adequate.
Okay,
and
so explain the process for making that happen.
You bet. So it's an old basic thing. We've always carried vitamins and herbs in pharmacies, but a lot of times they get forgotten about, and sometimes they are at the foundational or functional cause of some of the symptoms that we feel. Mm-hmm. Now, definitely there's a disease at work when we have a diabetic patient, but there's maybe some vitamins that they're missing still. Worse yet, there's potentially some vitamins or nutrients that get depleted by the medicines that they take. So we want to be able to address that and make sure that they're not running regularly a level down or depleted on these nutrients that really matter.
So you do a testing and you get the results, and you've got an example in your hand. You test for a lot of stuff to see what our levels are as patients.
That's right. Yep. We can make some basic recommendations, definitely based on medications that we see. We know they routinely deplete certain things.
Yes.
So we can make basic recommendations. We don't have to go through a full panel and testing. But at the same time, when that's maybe a next step or somebody just wants to start right at that because they're curious, we've got a panel that can tell us what nutrients are you low on. What is that a sign or a symptom of? Or maybe it's not a symptom of anything, it's just you're running low on it. For me, as an example, in the wintertime, it's vitamin D. And
for
it's
all
a
of
lot
us,
of
I
people.
think.
Exactly. It doesn't mean there's anything wrong, it's just a natural part of living in Michigan with low sunlight. Mm-hmm. So we supplement that. And this would tell us that along with multiple other very similar examples I could use.
So you've got a pack there sitting next to you on the couch that I want to talk about because that's interesting. Tell me about that.
Well, this is just our right pack process. So we can take all the medications, but definitely all of the supplements that have now been recommended or somebody wants to be taking in the morning, and put them all together in a morning dose. One of the things I've found that makes it difficult to stay compliant on my multivitamin or whatever other supplements I want to be taking is the bottles might run out at different times of the month, and remembering to go get another one is hard. Or there's 3 that I've got to take, but I forget to get all 3 of them out, or something like that, you know. So just making it easy makes it helps a patient be more compliant with the regimen they want to be on anyways.
Yeah.
And so this helps take out some of those life situations that just sometimes get in the way. And if you get off track for a week or 2, then sometimes you stay off track and don't get back on it. And so we recognize that need. Right Pack is a way that we address that.
All right, want to let folks know, I mentioned diabetes, but sports fatigue, hormone balance, cardiac health, lots of different disease situations or illnesses that you can come around and help folks deal with. And if you want more information about the HomeTown Healthy program, visit hometownpharmacy.com and search HomeTown Healthy. Good to have you here.
Awesome. Thank you so much.